Post-operative instructions. Sometimes, the after effects of oral surgery are quite minimal, so not all of the instructions may apply. Common sense will often dictate what you should do. However, when in doubt, follow these guidelines or call our office for clarification. Our number is 650-525-1033. If calling after hours, please listen to the message for instructions on how to reach your doctor. Day of surgery. First hour. Bite down gently but firmly on the gauze packs that have been placed over the surgical areas, making sure they remain in place. Do not change them for the first hour unless the bleeding is not controlled. You can gently remove the packs after 1 hour. If active bleeding persists, place enough new gauze to obtain pressure over the surgical site for another 30 minutes. Change the gauze as necessary, typically every 30 to 45 minutes. It is best to moisten the gauze with tap water and loosely fluff for more comfortable positioning. Exercise care. Do not disturb the surgical area today. Do not rinse vigorously or probe the area with any objects. You may brush your teeth gently. Please do not smoke for at least 48 hours, since this is very detrimental to healing and may cause a dry socket. Oozing. Intermittent bleeding or oozing overnight is normal. You can control bleeding by placing fresh gauze over the area and biting on gauze for 30 to 45 minutes at a time. Persistent bleeding. Bleeding should never be severe. Try repositioning the packs. If bleeding persists or becomes heavy, you may substitute a moistened tea bag for 20 or 30 minutes. Swelling. You can minimize swelling by using a cold pack, ice bag, or a bag of frozen peas wrapped in a towel and applied firmly to the cheek, adjacent to the surgical area. Apply the ice pack for 20 minutes on and 20 minutes off during the first 24 hours after surgery. Pain. You will usually have a prescription for pain medication. If you take the first pill before the anesthetic has worn off, you should be able to manage any discomfort. If you do not achieve adequate relief at first, you may supplement each pain pill with an analgesic, such as aspirin or ibuprofen. Some patients may even require 2 of the pain pills at once. If you find you are taking large amounts of pain medication at frequent intervals, please call our office. If you anticipate needing more prescription for the weekend, you must call for a refill during weekday business hours. Nausea. You can reduce nausea by preceding each pain pill with a small amount of soft food and taking the pill with a large volume of water. Try to keep taking clear fluids and minimize dosing of pain medications. Diet. Eat any nourishing food that can be taken with comfort. Avoid extremely hot foods. Do not use a straw for the first few days after surgery. It is sometimes advisable to confine the first day's intake to liquids or pureed foods, soups, puddings, yogurt, milkshakes, etc. It is best to avoid foods like nuts, sunflower seeds, popcorn, etc., which may get lodged into the socket areas. Over the next several days, you may gradually progress to solid foods. It is important not to skip meals. If you are a diabetic, maintain your normal eating habits or follow instructions given by your doctor. Sharp edges. If you feel sharp edges or something hard in the surgical areas, it is likely that you are feeling the bony walls that once supported the extracted teeth. Occasionally, small slivers of bone may work themselves out during the following week or so. Instructions for the second and third days. Mouth rinses. It is essential to keep your mouth clean after surgery. Use a 1/4 teaspoon of salt dissolved in an 8-ounce glass of warm water and gently rinse with portions of the solution, taking 5 minutes to use the entire glassful. Repeat as often as you like, but at least 2 or 3 times daily. Brushing. Begin your normal oral hygiene routine as soon as possible after surgery. Please make every effort to clean your teeth within the bounds of comfort. Hot applications. You may apply warm compresses to the skin over the areas of swelling. Hot water bottle, hot moist towels, heating pad for 20 minutes on and 20 minutes off to help soothe tender areas. Healing. Normal healing after tooth extraction should be as follows. The first 2 days after surgery are generally the most uncomfortable, and there is usually some swelling. On the third day, you should be more comfortable, and although still swollen, can usually begin a more substantial diet. The remainder of the post-operative course should be a gradual, steady improvement. If you are given a plastic irrigating syringe, do not use it for the first 5 days. Then, use it daily according to the instructions until you are certain the tooth socket has closed completely and that there is no chance of any food particles lodging in the socket.